Good afternoon, everyone. Thank you so much for joining the press conference today with NDP Leader Jagmeet Singh and NDP critic for immigration, refugees, and citizenship, Jenny Kwan, with special guests. Before I hand it off to Mr. Singh, I'd like to let everyone know that we'll be having a Q&A after the remarks, so please save your questions until the end. And now I'll turn it over to the NDP Leader, Jagmeet Singh.
Thanks so much, Nate, and thank you so much for all the media that's here today. We're talking about today a crisis that's going on in Canada, and that's a very serious shortage of frontline healthcare workers, particularly nurses. And we are seeing the impacts of this shortage in communities across the country, where people cannot get the care they need because there's just not enough nurses. We know that COVID-19 has been really difficult on healthcare workers. A lot of frontline healthcare workers have been burnt out, and a lot of nurses have been really struggling with lots of long hours and extreme work conditions. It's been very difficult. And one of the solutions is to have more nurses. But this brings us to a second problem, and that's the immigration system, which is denying opportunities for internationally trained workers and nurses and healthcare workers who could be contributing, but because of the failure of the Canadian healthcare or the Canadian immigration system, are not able to do their jobs. They're being left behind, and it is something that we want to fix. I want to thank Jenny Kwan, our immigration critic. She's also our housing critic who's here today, as well as Carla and Jella who are going to share their stories. And we really want to hear their stories so we can highlight the problems with the current immigration system and the reason why we should be so motivated to fix it. Jenny's going to get into some of the details, but I also want to point out, broadly speaking, our immigration system has been so backlogged that people like Carla and Jella wait so long to get any responses. It takes forever to get any feedback, and they're left in limbo. They're left uncertain and worried about what's going to happen next, when they should be instead working and providing the skills that they have and using those skills to provide a good service to people and to be able to do their jobs, what they've been trained to do and what they want to do. They want to care for people. They want to provide help, but they simply can't because of these problems in the system. So I'm going to pass the mic over now to Jenny, who's going to lay out some of the details and some of the solutions that we can provide. Simple changes to the immigration system that could immediately help people like Carla and Jella contribute and be nurses and work in a way that make them very happy and also help people out.
Thank you very much, Jagmeet. I'm very pleased to join with international educated nurses and, of course, our leader, Jagmeet Singh, to call on the Minister of Immigration, Refugees and Citizenship to take immediate action to expeditiously grant permanent residence to qualified individuals. As the leader had said, Canada is faced with a significant nursing shortage. Yet internationally educated nurses who have worked hard to meet Canadian standards and are in fact licensed to practice in Canada are unable to work as nurses because of the massive backlog and the extensive delays in processing PR applications by Immigration, Refugees and Citizenship Canada. Let me be clear, the only thing that is blocking them from working in their profession right now is because of their current work permit is employer specific. It is entirely because of the problems with our immigration system. They cannot switch employers even if they were offered a position as a nurse in a hospital or a healthcare clinic. In fact, I've spoken with nurses who have been offered a job and they have not been able to accept that position because they do not have the immigration authorization to do so. This is a complete waste in human potential at a time when Canadians need their talents the most. They are here, they have the experience, they have the qualification, and even if they have managed to get a job and been offered a position, they remain stuck behind federal red tape with no sign of movement. The minister needs to recognize that the federal government is the roadblock. And the fact is that their application for PR is stuck in the system with excessive delays in processing. for up to 2 years in some cases. This is not acceptable. And as it stands right now, these individuals, they cannot even get an update on what's going on with their application. This is how bad the situation is. The Liberal government needs to be part of the solution to Canada's nursing shortage instead of being the problem. So the NDP is calling on the government to immediately issue a bridging open work permit to those waiting for their permanent residence application to be processed. More to the point, to alleviate the nursing shortage, the NDP is also calling for a simplified immigration measure to grant permanent residence status to healthcare workers who meet qualifications. The government needs to greatly increase staffing and resources at IRCC to deal with the massive backlogs. It is not right for individuals to have to wait and for their lives to be put in limbo for such a long time. And it is equally wrong for us to not recognize their talents. They have passed all the exams, they are licensed, they are ready to work. Let's make that happen. And the immigration system needs to be fixed in order for that to take place. And the Minister of Immigration, the Liberal government, has the authority to make that happen now. Thank you.
Thanks so much, Jenny. And to now hear the stories from people who are faced with this challenge right now, we've got both Carla and Jella, and we'll go first to Carla. And Carla, just share your story. There's folks that will really benefit from hearing what you're going through. There's probably so many people that are going through something similar. So we'll start with Carla, and then we'll go to Jella Ann.
Good afternoon. Thank you so much for making time to be with us today. I am Carla, and I am an internationally educated nurse from the Philippines. I am a part of a group of 23 internationally educated nurses currently working as caregivers here in Canada. We all have ongoing RN and RPN applications with the College of Nurses of Ontario, and all of us have passed the registration examination, jurisprudence exam, have met the education requirement, have updated our safe practice, and have submitted proofs of our English language proficiency. The only requirement that we haven't met to be licensed as professional nurses in the province is the authorization to practice nursing. This is either a permanent resident status or an open work permit. We have submitted permanent residency and open work permit applications to the Immigration, Refugees, and Citizenship Canada. While a very few received some updates, many of us have only received temporary file numbers, and there are even some who have been told that their applications haven't been opened yet. Many of us have been waiting for more than a year now, and not only that this has affected our nursing career pursuits, it has also taken a toll on our mental health. We are always hoping to hear that there is movement in our applications, but we end up very frustrated each day. Because of the pandemic, the healthcare system has been greatly affected, and that the country is facing a nursing shortage. We are here and we are ready to serve. But in order to do that, the government must help us. For us to be licensed as nurses, we plead IRCC to help us with our one last requirement. Help us obtain permanent residency status or give us an open work permit for now. It also breaks our hearts that we are just watching from the sidelines while our peers in the Canadian healthcare system are overworked and stressed out. We are here and we are ready to help. Thank you.
Thank you so much, Carla. That really provides a clear example of how we're just having a barrier with the federal government right now. That's the barrier for you to be able to work, and that should not be happening. That's wrong. Really, thank you for sharing your story, Carla. Next up, we have Jella Ann. Jella Ann, please share your story as well. We're just going to make sure, Jella Ann, it gets unmuted before.
Okay,
there you go.
Okay. Good afternoon, everyone. I am Jella Andakal, and I am a nurse by profession back in my home country. I've been here in Canada nearly 5 years and have been separated from my loved ones, especially my husband, ever since. My journey started from being a child caregiver to a personal support worker. Without having any updates on my PR application, I am worried that I will be soon out of status as my open work permit will expire on January 2022. With regards to this, I am not also eligible to renew my health card or OHIP because I am not yet full-time on my job. We have followed every single protocol and guideline by IRCC, but it seems like we have been forgotten. It is an endless cycle of countless applications and fees, near expiring status without having any updates, a never-ending waiting game for more than 2 years, and after all of that, we still haven't got any concrete answer. We understand that due to unforeseen circumstances like the pandemic and other factors, it has affected the logistics and workforce of IRCC. But being in our shoes with what we are going through is overwhelming. It has affected us emotionally, physically, financially, and most of all, mentally. My husband and I plan a life here in Canada, but because of that situation we are in, our dreams and aspirations have come to a halt. In a perfect world, we could have been together here and we could have helped the Canadian healthcare system during this crisis. With the world adjusting to the devastation brought by the pandemic, we sincerely hope that the immigration system would adapt as well. We are not asking for too much. What we are merely asking is to provide what is due for us. We are praying and still hoping that we, the deserving and patient ones, could be prioritized this time. That would be all. Thank you.
Thank you so much, Jella. And again, what Jella and Carla are laying out is they want to work. They can work. They've got the skills to work, and they're qualified to work. And we need that. We need both Jella and Carla to be working. There is a shortage, but they simply cannot because the federal government has created a barrier. So we laid out 3 really clear and simple solutions. One, an immediate bridge so that these workers can actually continue to do their work. 2, a quick path, making sure that they are immediately made permanent residents, understanding that we've got a specific need for healthcare workers and nurses. So make that an immediate process so that they can become permanent residents. And finally, more staffing. We need to have more staff to deal with the backlogs and process these applications. These 3 things would be incredible in the lives of Carla and Jella Ann, and it would be a meaningful difference for people that are dealing with this crisis right now of a shortage of healthcare workers, particularly of nurses. We can fix this, and that's why we're here today, to call on the government to make these changes so that we can actually tackle this crisis and ensure that we've got people that want to contributing to their fullest. With that, I want to pass it back to Nate and see if there's any questions that we can answer. Thank you.
Thank you so much, Jagmeet. So we're now going to have a media question period. So journalists, if you have a question, please use the raise hand function. And when you're called upon, you can go ahead. You have 1 question and 1 follow-up. So up first is Ashley Burke, CBC News.
Thanks for taking my question. Mine's for Mr. Singh. I'm hoping to find out if you've seen video footage that a filmmaker released as the RCMP arrested him, another journalist, and a pipeline opponents on Wet'suwet'en territory last week. What's your reaction to this video, and do you think the RCMP overstepped?
I haven't seen this particular video, but I can say from what I've heard and what I've read that there is no question that there is serious concerns that have been ongoing about the use of force of the RCMP. We've seen example after example across the country, and this applies to policing in general. There is a very troubling tendency for escalation instead of de-escalation, use of force when force should not be used. We've seen it particularly used against racialized people, and in this particular example, against Indigenous people. And we've been calling for reform to the RCMP for a long time now. And that's fallen on a Liberal government that does not seem to care to bring in those changes. So we believe that there needs to be changes to the RCMP and an overhaul of their practices. And we've seen some really troubling examples of that use of force against Indigenous people, which you've alluded to, as well as racialized people in general.
And do you think the federal government should get involved and start trying to lower the temperature out there, help try to reach an agreement?
We've had a conversation with Taylor Backrack, who's a local member of parliament that represents a community, as well as Laurie Idlout, who's our member of parliament from Nunavut and a critic for Indigenous affairs, with some of the hereditary chiefs. And one of the things they pointed out, and folks will recall, when the tensions were at their highest, we pushed to have the federal government get involved. And their involvement actually helped bring down the tensions because it helped to address the question of title. And specifically, the Wet'suwet'en hereditary chiefs want to know that they have authority over what land. And right now that's not been established, and the Canadian government is actually responsible for that. So what we've heard from the chiefs is that on that process, that discussion and that negotiation to actually establish their land title, that's slowed down and that's bogged down, and they feel that it's the federal government that's slowing it down. And so I absolutely believe the federal government, if they negotiate and work in good faith to establish the title that is rightfully in law, something that the Wet'suwet'en hereditary chief should have, that work would certainly help bring down tensions, because it would actually establish the rights that they know they have, that has been confirmed by the Supreme Court, but hasn't been laid out in detail in terms of what is the boundary. They want to have that established. So that would certainly help. And we are again calling on the federal government to do the right thing, to have those negotiations in good faith, and having heard the concerns that they are slowing down the process to not do that, to make sure it's going along at a good pace.
Thank you so much. We're now going to Laura Osmond from the Canadian Press.
Hey there, can you hear me?
Yep, we can hear you.
Wonderful. Thanks for hosting this today. I wanted to clarify what kind of people you're talking about when we're talking about the nursing shortage, like what kind of status we're talking about. Are we talking about temporary foreign workers? Are we talking about refugees that these changes would impact?
I'll start off, and Jenny can give some more detail. Right now, we're speaking of people like Carla and Jella who came here as caregivers. They had a work permit for caregivers, but because of a barrier in the Canadian healthcare or the Canadian immigration system, can't apply their skills towards nursing. They've laid out that they've completed all their qualification exams. They've completed their qualifications to be recognized in Canada. They've done that through the Ontario Nursing Board. So they've done all the steps necessary. They are qualified now. The only thing that's stopping them from working in a hospital as a nurse in Ontario right now to deal with the nursing shortage, the only thing that's in the way is their immigration status. And that's the Canadian government's fault. And so we're saying people like Carla and Jella and many, many more like them could immediately be working as nurses in Canada, if some simple changes were made. And I'll ask Jenny to add some more details there.
Thank you very much for that question. Most definitely, this impacts temporary foreign workers, no question about it. Both Carla and Jillian and many others are temporary foreign workers. They are here as caregivers. And they have received a work permit to be an employer-specific work permit, so they cannot work for any other employer. So in this instance, many of the people have actually gone through the extensive process of making sure that their experiences and knowledge and educational background from back home would meet Canadian standards. So they have actually went and wrote all the tests and did all the credentialing requirements and got their license to practice nursing here. The only problem is that they do not have the immigration authority to have a different employer, whether that employer is with a hospital or an employer with a health clinic or in any other healthcare setting. So what we're calling for is for the government to recognize the talents of these temporary foreign workers and to give them permanent resident status so that they can, in fact, be part of a healthcare system to support Canadians, especially during this difficult time. I would further say that for those who are refugees, and some of them are refugees that are here in Canada, the same could apply to them as well. This ought to apply to anyone who, because of immigration barriers, are not able to practice in the healthcare profession. If they have the credentials, and they have met the passed the exam requirements and a license to do so, we should utilize that. That's actually recognizing the talents that we have right in our own backyard with these workers. The government previously had brought in a measure for Quebec for refugees, but it was very limiting. But in many ways, what they can do is to apply that process across the board to these other workers and across the country.
Thank you for clarifying. That makes a lot of sense to me. Now, the government did create a pathway to permanent residency specifically for healthcare workers, like the ones we're talking about today, who are already here. There wasn't a lot of uptake, it looks like, but there was a separate one for refugees as well. I'm wondering, does that not work for you? And I'm also wondering to Carla and Jella, did you apply for that, and what was that process like?
I'll start with Jenny on this, and then maybe if Carla or Jella would like to provide an answer as well, if they can, or if they know of that system. Jenny?
Thank you very much. Yes, for some of them, actually, they have submitted their permanent residence application to get status. The problem is that they're stuck in the system. It's being processed and it is so slow, right? People minimally wait for at least a year. I've talked to caregivers and other healthcare professionals who's been waiting for more than 2 years, and they're not getting the status recognition. Their application is not being processed. So as a result, is as good as nothing. The government can make all kinds of announcements to say that they will do this, they will do that, but without actually doing the work, it doesn't mean anything. So for these workers, for both Carla and Jeline, they actually made the application and they're stuck in the system. That's why they cannot practice as a nurse right now, even though they are licensed accordingly. Aside from all of this hardship, there's the personal side to the story as well. As we heard from Jeline, her situation, and her situation is not unique. Everybody is separated from their loved ones, whether it be from their partner or their children, right? And they're here to take care of Canadian families, and they're separated. So there's just something very fundamentally wrong with our immigration system that tears families apart like this. And this is a double whammy. Families are torn apart, and we're not recognizing the skills that they have. The government's made these announcements to say that they're going to do this, they're going to do that. And that's always the problem with the Liberal government. They say all the right words, but they don't actually do it.
Thanks, Jenny. And did Carla or Jella want to speak to the fact that which application you've made, and if you made an application to that announcement, and if it's, I think Carla might want to respond. Carla, go ahead.
I think she's talking about the TR to PR, the new pathway. I did not apply to that because we were promised before that there was an announcement before that they said that the people who are qualified in the year 2020 will be given permanent residency. There was a promise, 6,000 caregivers. So we thought maybe we can give the chance to other caregivers who cannot meet the requirements. That's why I did not apply for a TR to PR.
Thank you for that, Carla. Thank you for Carla. That really helps. And Jella, did you want to add or no, not to this one? Yeah, Jella, we'll make sure you're unmuted first. Thank you.
Okay. For me, I applied for HCCP pathway since 2019 that time. And as what Carla said, for TR to PR, we just give way for the people who are really in need on that way. And as for my application, I was already on the background check. And if I'm gonna apply again for that TR to PR, another payment again for me. And I just earn money just for my rent and for supporting my family back home. Yeah.
Thank you, Jella. So we've got a couple of concerns. One is that they've already applied, and so they're waiting for that answer, and that hasn't happened. And some of them made a decision because of the opportunity as a registered nurse that they've already applied in that pathway. And so what we're really saying is that clearly all these pathways are not working. The current pathways that are being provided just don't work. So that's why our 3 steps. We need immediate bridging so that folks can immediately start working. We need a fast track so they become permanent residents that actually works. And then we need the staffing so that it doesn't take years and years and years of limbo and uncertainty and waiting. Instead of taking years and years of waiting, we want to see these processed immediately, given that we're in a healthcare crisis. And we've heard really compelling stories from people about how bad things are in hospitals, in long-term care homes, where they need nurses, where they need nurses in other healthcare settings. So it's really serious now, and we need to get immediate help. Back to you, Nate, for other questions.
Thanks so much. So we are running a little low on time, so I think we'll have time for one more question, and that will go to Boris Prou from Le Devoir.
Bonjour, Monsieur Singh. J'ai compris que certains problèmes soulignés étaient, par exemple, le manque de ressources, plus d'employés pour gérer les dossiers. J'aimerais aussi savoir si, selon vous, il y a un problème fondamental avec le système d'immigration qui nécessiterait, par exemple, un projet de loi ou des changements vraiment majeurs sur les programmes. Et finalement, j'aimerais aussi que vous me dites si vous croyez ce que nous a dit le nouveau ministre de l'Immigration, Sean Fraser, hier, selon qui on s'attaque maintenant au racisme systémique dans le système d'immigration. Si vous avez quelque chose à dire là-dessus.
Oui, bien sûr. Juste plein de choses à dire. Merci premièrement pour la question. Donc, il y a plusieurs enjeux. Donc, premièrement, c'est oui, il manque de ressources. Avec Carla et Jella, on a des personnes qui ont fait tout le travail nécessaire pour être qualifiées. Donc, ils ont réussi à passer leur examen. Donc, ils ont toutes les qualifications d'être des infirmières, des infirmiers ici au Canada. La seule barrière à ce moment, c'est leur statut, leur situation d'immigration. C'est la seule barrière qui prévenir ces gens de participer comme des infirmières. Et on sait qu'on a un grave manque des infirmières à ce moment au Canada, au Québec aussi, mais à travers le pays. Donc, le fait que c'est une situation d'immigration qui est la barrière et c'est complètement la responsabilité du gouvernement fédéral, c'est vraiment une faille de leadership. Donc, oui, on a besoin de plus de ressources pour accélérer les applications, mais les chemins ou pathways, les chemins de devenir des résidents permanents, ces chemins ne fonctionnent pas. Donc, oui, on a besoin d'un changement total de la système pour régler tous ces problèmes, mais immédiatement, on a besoin d'un chemin qui fonctionne clairement, rapidement, immédiatement pour les travailleurs en santé, pour régler cette crise en santé qui existe, où on a entendu des histoires horribles de comment les infirmières et infirmiers à ce moment ne peuvent pas continuer parce qu'ils ont trop de travail et un manque des ressources humaines. Donc, on doit régler ça rapidement, immédiatement. Et puis, votre question finale sur le racisme systémique, bien sûr, ça existe dans toutes les institutions, dans tous les systèmes, mais particulièrement dans notre système d'immigration. Il n'y a aucun doute que ça existe là. Et le problème, c'est ça blesse, ça nuit à toute la société parce que c'est le Canada, le Québec qui souffre à cause de ce racisme systémique dans notre système d'immigration fédéral. Et à cause de ça, les gens comme Carla et Jella ne peuvent pas contribuer comme elles veulent contribuer et comme on a besoin de leur travail, de leur contribution. Donc, ça, c'est le problème.
Merci. Très rapidement en suivi, j'aimerais savoir juste une petite mise à jour sur la motion numéro 1 pour le Parlement hybride. Est-ce que vous avez donné votre appui à l'allocation de temps et qu'est-ce qui arrive avec ça au Parlement? Je ne sais pas si vous pouvez me donner une petite mise à jour.
Oui, bien sûr. Oui, on a déjà eu le vote sur cette question et notre parti a voté oui pour l'allocation de temps. Et cette nuit, je pense qu'à 9 heures, on va avoir le vote final. Donc, on sait qu'il y a des outils importants pour s'assurer que les députés peuvent représenter le comté. Et avec la menace de la COVID-19, le fait qu'on ne sait pas le statut à ce moment, le status des conservateurs, s'ils sont vaccinés ou non, combien. Et aussi avec le fait qu'il y a un député conservateur qui est tombé malade avec la COVID-19. C'est un outil important pour garantir que les comtés et les gens vont toujours avoir la représentation. Merci. Back to you, Nate.
Thank you so much, everyone. This concludes the press conference. Thank you so much again.
Thank you. Thank you, Jenny. Thank you, Carla. Jella, and you did a great job. This is really, really good. Thank you so much. Thank you, everyone.
Thank you. Thank you so much.
And I noticed lots of comments from folks that were listening in. I really appreciate those comments as well. Jenny?
Yes, thank you so much, Jagmeet, for joining us for this press conference, and of course to both Carla and to Jeline, the caregivers, all of you. I just can't thank you enough for the hardships that you experienced, but despite that, you persist and continue to push forward, not only just for yourselves, but also for us here in Canada as well. So much appreciate all that you do, and we'll continue fighting for you. This is not the last time we're going to push this. We're going to keep on pushing this until it gets done.
We're hoping for that.
Thank you so much.
Thanks.
Thank you again.
Take very good care.
Bye-bye.
Have a great day.
You too.
Salamat po again. Bye-bye.